Isn't high blood pressure something that people get after 50 or 60? So, why are so many young adults facing it right now?
Essentially, hypertension is what we call a silent killer, which basically means by the time you have symptoms, you would already start having end organ damage.
So, now let us talk about stress. Why it is such a big factor for our generation? What about phones, screen time, and social media? Are they like a part of this problem?
Yes, definitely. They're definitely part of the problem. We talked about sensory overload early on. Most of our brains at a younger age are not used to. We're just exposed to all this very early. We're not used to filtering out, we're not used to processing this data. And just like a laptop would crash, we have a brain crash. So this is what is happening. And prevent the three biggest scourges of India, which is a heart attack, stroke, and an acute kidney failure. We call it a cardiovascular disease. And as you know that 35% of Indians are going to die of cardiovascular disease early. And if you can just take care of one blood pressure, a cholesterol, and a sugar, the chance of you developing cardiovascular disease is going to be very, very low.
So, what are the most effective changes young people can make if they have just been diagnosed? Hello, everyone. This is Prakriti, who welcome you all to Heart, the podcast where we bring heart-health conversations closer to real life. Our today's topic might surprise many of you: high blood pressure in young adults. Yes, you have heard that right. We are seeing more and more people in their 20s and 30s being diagnosed with hypertension, often without any symptoms at all. Why is this happening? What are the warning signs? And most importantly, what can we do about it? Well, to answer all your questions, we have our expert, Dr. Johann Christopher, someone who's been working closely with young patients and helping them reverse early heart risk through awareness and prevention. Let's start right there, doctor. Isn't high blood pressure something that people get after 50 or 60? So, why are so many young adults facing it right now?
Yes. The important thing is that what used to happen at the age of 60 is now happening at the age of 20, and I call it sensory overload because there is so much things happening at that young age. And we classify it into the four M's. The first M is no movement because everybody's sitting on the desktop the whole day. The second M is the meals are really erratic and we're getting fed by apps and not from real kitchens. The third M is that we're not able to manage ourselves and our time. So we are taking on a lot of projects and we have limited time. And the last M is that there is no kind of mobilization for sleep. Sleep is one of the biggest tools that we had in the last decade, which helped us to recuperate from whatever was going on. But unfortunately, the sleep is not there anymore. So these are the four essential factors which have caused a lot of the non-communicable diseases, especially hypertension, to start so early in the 20s compared to what it was a couple of years ago, where it started at 60.
Hmm. But, doctor, what if someone is young, active, and looks fit? Can they still have high blood pressure?
This absolutely, we call it the fit paradox. So we have a couple of patients, not too many, who are absolutely fit. They go to the gym, they have a good lifestyle, they eat healthy, they're very conscious about their selves. But however, internally things are not that good. They're eating way too little, their mental stress at an all-time high, and they're not sleeping. So while the exercise part is great, there is mental stress, there is no sleep, and there is a lot of pressure. So these are the people we call the paradoxical fit people who on the outside look great, but internally pressure is piling on. And one of the big releases of pressure manifestations is hypertension.
That's actually quite relatable. So, doctor, are there any signs that young people can watch out for?
Yeah. Essentially, hypertension is what we call a silent killer, which basically means By the time you have symptoms, you would already start having end organ damage. But there are subtle clues in the history that tell us, for example, unexplained headaches, unexplained lack of sleep, unexplained anxiety, tension, unexplained bouts of anger, and more importantly, unexplained lightheadedness and unexplained fatigability. Someone is fit, he's going to the gym, but he's just exhausted at the end of the day. So these are the subtle clues that we should be on the lookout for, and physicians should be on the lookout for, or caregivers should be on the lookout for to pick up the early signs of hypertension.
Right, right. So now let us talk about stress. Why it is such a big factor for our generation?
Yeah, as I said before, there is a lot sensory overload right now. We used to make a phone call once a week a couple of years ago when I was in medical school. And now we're making a phone almost every 10 seconds. So you can imagine the amount of sensory stimuli that the brain is having to handle. And it's not the auditory, there's visual, there's WhatsApp, there's movies on the phone, there's cricket matches on the phone. We all sat together once a week and saw Chitra R, for example. But right now we are watching it every second. So sensory overload is one of the biggest things that are happening. The second thing, there's a lot of pressure because of the circumstances around us, the jobs, the vehicles, the dresses that we have. There is so much available, so it becomes very very tough to make those choices. And the third thing is we have a global vision right now. So what's happening in Paris is very easy for us to get. Before, if something was happening outside, it took us days, months, and sometimes years to get it. And we were very patient. We were able to understand the value of waiting. But today, everything is available at a click of a button. So while that is good in one way, it creates an overwhelming amount of sensory stimuli our brains are not equipped to handle. And when you add the lack of sleep, where the brain is actually allowed to cool off like an engine, there is no sleep. So a lot of engine activity, no rest, and the recipe is disaster.
Can you give us a real life example about someone you have treated?
Yeah. So we have a couple of these examples. They generally are a young software engineer, the late 20s, early 30s, quite fit, very particular about their diet. They do their exercise. And then they come with this unexplained headache. They come with increasing tiredness. And when we look at them, they've already done the Google work. They come with a lot of reports. Many of them are near normal. But what they haven't done is they've not been examined by a physician. And the first thing we do is we check the blood pressure. The blood pressure is sky high, about 150 by 90. The heart rate is racing at 100. And then when we look at the lipids, the LDL cholesterol is about 150 and the sugars are about 200. So, as I said before, external things are looking great, but when you do a little bit of internal examination, a lot of things are going bad. The sugars are high, the blood pressures are high, the cholesterols are high. And these are the three recipes for all the problems that we have, the cardiovascular diseases and deaths that come. So, very clear live example of what looks good outside is truly not good inside.
What about phones, screen time, and social media? Are they like a part of this problem?
Yes, definitely. They're definitely part of the problem. We talked about sensory overload early on, and social media is what I would call an extreme example of sensory overload, where there is visual, there is auditory, and now there is also haptic touch. So all these inputs are going into the brain, and the brain does not have the capacity to process it all at once. And as we talked about rest from the screen, rest having sleep, so both the rests are not there. So huge amount of overload, lot of processing. Most of our brains at a younger age are not used to. We're just exposed to all this very early. We're not used to filtering out, we're not used to processing this data. And just like a laptop would crash, we have a brain crash. So this is what is happening.
Wow. So, doctor, when should a young adult start checking their blood pressure?
Well, we really don't have a number right now, but one of the proposals that many of us have made to the government of India and to the Heart Health Foundation of India is that the right time is when all the students converge to the universities at around the age of 17 to 18, when they complete their plus two and they're out trying to pick up their undergraduation. So they come in with a lot of their documents, and I think one of the documents should be a health report card. Any physician can give it, which would include one blood pressure reading, one fasting blood sugar, and a lipid profile. I think this should be mandatory by all universities to be before the child gets admission. The reason is that if we pick up these issues early, hypertension, diabetes, and high cholesterol, we will have a lot of time to treat them through lifestyle and medication and prevent the three biggest scourges of India, which is a heart attack, stroke, and an acute kidney failure. We call it a cardiovascular disease. And as you know, that 35% of Indians are going to die of cardiovascular disease early. And if you can just take care of one blood pressure, a cholesterol, and a sugar, the chance of you developing cardiovascular disease is going to be very, very low. So 70, my guess is 70.
So, what are the most effective changes young people can make if they have just been diagnosed?
Yeah, so if they've just been diagnosed, we talked about the four M's, and I think that's a great way to start. So the first thing is always mobility. Humans, if you look at our body shape, we're just meant to be mobile. We're meant to be on the move. So just take yourself out of the chair, get a cup of coffee, walk across to the supermarket. Don't order from Blinkit. Move, keep moving, and that's the first step. The second M is about having a mental peace. Mental peace means a little gap from screen time, having a good night's sleep. These are very important. We need to be recharged just like our phones and laptops. So that's the second M. The third M, obviously, is uh, the kind of meals that we have. We talked about being fed by apps and not real kitchens. I think it's very important to get back to the family, to get back to having food together, learning a few recipes, healthy recipes. We have a lot of foods which are now available. You can pick them up, get them home, and just put it in the microwave and cook them. So these are great, ready to eat meals, but it should be done at home in a good kitchen, safe kitchen, a clean kitchen. And that you can also experiment. You can add a lot of value based foods. You can also add a lot of nutrition. It's very easy to compare what it was about 10, 20 years ago. And the last thing, obviously, is we must be at peace with our fellow humans. So I call it the migratory philosophy. We need to be at peace with our neighbor. We need to be at peace with our work person. We need to be at peace with our family member, because that's how we develop good social skills. Our neurons develop, our brains actually start getting enlarged. But most of the time, we're looking into ourselves, we're looking into the mirror, we're looking into our screens, and we have no time for others. So the neurons don't expand, but they actually start contracting. So, one of the great things of preventing dementia and old age is somebody who's well connected to people, somebody who's doing social work, somebody who's doing something without any kind of selfish gain. They seem to live very long. They live to 80, 90. We've seen a lot of our social workers doing that. And one of the great things is that they're able to connect outside of themselves. They're able to subtract the I and they look at the we and they look at the us. So I think this is a very important thing that should be inculcated very early, to be part of a team, to do things apart from your work, and to contribute to society. And we are going to be living very long and we're going to be living very healthy.
Well, if someone will need medications, will it be permanent?
No, as I always say, that nothing is permanent, because medicines are just one of the mechanisms by which to decrease blood pressure. So we usually start with lifestyle modifications. We start with the diet, we start with mobility, we start with good sleep. And for many people, especially young people, if we catch them early, that's all there is to get your cholesterols, your blood pressure, and your sugars down. You don't need any medication. But generally, the recommendation from most societies is if you've completed 3 months of lifestyle and your blood pressure is still high, generally we like to look at a blood pressure of more than 140 by 90, then it's time to start medication. The medication today is very safe. It's once a day. There are not too many medicines available. And more importantly, these medicines will just be a stopgap. So you could start on medication, keep it on for 3 months, the blood pressure comes down, your cholesterols come down, sugars come down, and then there is a possibility that the physician will slowly taper down the medication and finally stop it. If your physical activity has reached a good level, your diet has become well organized, and you're getting good sleep, certainly when the blood pressure comes down, we're going to stop the medication. We're looking at goals today. We're looking at a blood pressure goal, we're looking at a sugar goal, we're looking at a cholesterol goal. So once we reach those targets, I think there's no harm in cutting down, decreasing, or stopping. But that's a physician's choice. We should leave it to him.
Now, doctor, your final message. One line to all the 25 to 40 years old listening right now.
Yeah. Once again, thank you for this platform. And I think one of the big messages I would like to take across today is that Indians are dying early. Indians are dying of non-communicable diseases. The biggest non-communicable disease that we have is cardiovascular disease. The three drivers for cardiovascular disease is hypertension, diabetes, and hypercholesterolemia, which means a high blood pressure, a high sugar, and high lipids. So if we can use the 4 M's that we talked about, being mobile, eat good meals, have good sleep, and connect with the world, I think there is no reason why India should not be called the capital of lifestyle diseases or the capital of cardiovascular disease. It should be called the capital of the care of cardiovascular diseases. We should take care of people, and many people in the world will look to us as a country. Thank you.
Thank you so much, doctor. That was really and very insightful session.
Thank you.
To everyone listening, high blood pressure doesn't wait for grey hair. It's knocking on younger doors now. So take charge early, start small, and be consistent. We will see you next time on Heart to Heart, where we dive into diabetic hypertension, the double trouble that affects millions of Indian families. Until then, this is Prakriti signing off. Remember, breathe deep, walk often, sleep on time, and protect your pressure.